Hello everyone, I'd like to discuss a few things on smoking while pregnant along with other issues that go along with smoking. So everyone knows that smoking is bad and that can cause a lot of health issues. Even just with adults, there are a lot of adults that are suffering from COPD, which is chronic obstructive pulmonary disease. A lot of people are losing their lungs or having to be on respiratory machines throughout their life due to smoking. So I want to talk about smoking while pregnant and the harmful effects that it can cause during a pregnancy to the unborn fetus. So imagine someone that you love is planning on getting pregnant and is smoking cigarettes. Are you going to tell them to stop? Are you going to tell them the harmful effects that it can cause? Or are you going to sit around and allow them to smoke and just be okay with it and watch them smoke, knowing that the unborn child has no say? They can't tell you, don't smoke, mommy, you're hurting me. So everyone knows that smoking, regardless, has several consequences and long and short-term effects if you smoke. Smoking not only causes lung cancer and throat cancer, but can also cause several other birth defects to an unborn fetus. Every 2 seconds, someone in the United States is smoking while pregnant, not thinking about their unborn child. Mothers need to be aware of what could possibly happen to their unborn child. There is a lot of help out there and hotlines to help mothers who are smoking to help them quit, because mothers need to be aware that any substances or any harmful things putting into their body, that it is all going to the baby. The baby is feeding off of the mother. That's why we try to tell mothers to eat healthy, to not drink, to consume a certain amount of coffee throughout the day, because everything is going to that baby to help that baby grow. So all the smoking, all those substances is going straight into the baby's lungs. Today I would like to discuss a few important reasons as to why you shouldn't smoke while pregnant, and then I'm going to explain why it is important to maintain a healthy drug-free pregnancy. Finally, I'm going to explain why a lot of people oppose of the idea that smoking causes birth defects, and then I'm going to deliver my beliefs and state why my solution works better. There are many babies being born across the world having to be incubated related to smoking during the pregnancy. Asthma is one of the main things that babies develop from a mother smoking during her pregnancy, as well as a lower birth weight and long-term effects, as well as short-term effects that harm the lungs of an unborn child. If you see some mothers, it can cause that are smoking, it can cause mothers to go into preterm labor where the baby is going to be incubated, because your lungs are not fully developed until the mother is at least 36 to 37 weeks pregnant. That's why they say that they prefer for a mother to go up to 36 weeks or 37 weeks to be able to deliver a child, because your lungs are fully developed just about. Even after the baby's born, the lungs are still growing and still producing. So it is very imperative that a mother does not smoke or do anything harmful to eliminate any issues with the baby's breathing. Many babies are suffering from breathing issues. Many babies will suffer year-round when the seasons changes and could possibly be hospitalized for respiratory issues. My child also is one of those children who have asthma. Secondhand smoke can also harm the child, so mothers need to be aware, who are trying to get pregnant or who are pregnant need to be aware that even being around secondhand smoke, that there is a third-hand smoke that could also harm the child or even the unborn child. Mothers across the world need to be aware and be informed how imperative to have a safe and healthy pregnancy, because in the long run, they are protecting the fetus from harm and long-term effects once the baby is born. Babies are dying every second, every year, or every single day due to respiratory issues. These children are not given a chance. When the mothers are smoking during pregnancy, you are not giving that child a chance to even survive or even to be able to live a normal and healthy life. Babies being delivered are put in incubators, having to live on life support or have oxygen machines put up to them and have tubes running through them. They could be on there for days on end or even months and being stabilized and being admitted in the hospital for months on end to help them maintain a healthy breathing technique. Now that I discussed the important reasons as to why you should not smoke while pregnant, I'll discuss why a healthy pregnancy is beneficial to the unborn baby. Everyone should maintain a healthy pregnancy because everybody wants their baby to grow up and be healthy. Everybody wants their child to be able to live a normal and healthy life. Nobody wants their child to suffer. No one wants to bring a child into this world and have to see that baby put inside an incubator and have to watch them and not be able to hold their child because they need to be put up to a machine because they're not able to breathe on their own. How sad would that be to have to watch your child suffer because of your own actions, smoking while pregnant, to have to watch your child sit inside of a machine with tubes running through them, having monitors put on them because of your own actions, because you chose to smoke while pregnant. Everyone should maintain a healthy pregnancy. The fetus depends on the mother for nutrients, depends on the mother for the oxygen, depends on the mother for anything that is being put into that body to help them grow into a healthy born baby. Stop smoking and become a selfless mother and worry about the baby inside of you and to make sure they are safe and healthy. A lot of mothers, they're worrying about either their weight or worrying about this, and instead they're not worrying about the child that's inside of them. They're not aware that anything that is put into their body, the baby is taking everything from them. That's why they also tell you to drink a lot of milk. The baby steals every bit of nutrients, proteins, any nutrition within your body, the baby is stealing that from you. So that's why it is imperative to make sure that you do not drink, you do not smoke, or put any harmful substances in your body because everything is going to that child. Eat healthy and don't put harmful substances in your body while pregnant because, again, like I said, the child is taking in everything. Even while breastfeeding, they say you shouldn't smoke because the baby is taking in all those nutrients. That's why a lot of doctors nowadays are trying to stop and discontinue prescribing medications when the patient is discharged because the patient is going to be breastfeeding, so the child is going to be taking in those harmful medications. I would think that putting together pamphlets and giving numbers to hotlines or any other resources out there that will help mothers or even adults to help them stop smoking will decrease and eliminate the rates of babies dying or suffering with their birth defects. Babies will be saved and be able to have a healthy birth. Babies will benefit because they will be given a chance of having a healthy life growing up, instead of having to suffer and deal with any breathing complications like asthma or year-round seasons that will affect the breathing, especially if they develop asthma from a mother who is smoking because their child is susceptible to getting pneumonia either 2 to 3 times a year, and then some of the times if it's a bacterial pneumonia, your child's going to be hospitalized. Who wants to see their child in the hospital with pneumonia 3 times a year, or even having RSV or upper respiratory infections? I am a mother myself. I would never want to see my child hospitalized for certain things, say if I were to smoke while I'm pregnant, because inside I'm going to feel guilty knowing that my child is in there suffering because of my own doing and my own actions and not thinking about my child while pregnant. It is obvious that smoking kills many lives of babies, and including adults, like I stated earlier. But many will oppose that smoking is the reason for birth defects, and even death that babies are born with while the mother was smoking while pregnant. Some will argue that smoking while pregnant does not cause birth defects. There are a lot of women out there who are going to say, oh, I smoked with all my pregnancies and none of my children had any asthma or any birth defects. But how do you know? Because that might have been a short-term thing. How do you know in the long run that child's not going to suffer from any problems with breathing issues? Sometimes issues might not be visible in the beginning, but sometimes there will be issues and a long-term effect that will come about from smoking while being pregnant, or even secondhand smoke that the mother was around during pregnant. Statistics prove that smoking while pregnant causes miscarriage as well as decreasing the odds of conceiving. A lot of mothers who are trying to get pregnant are unaware that while smoking and you're trying to conceive decreases your egg count. Women all know that we are all born with a certain amount of eggs. We're not like men. We don't constantly reproduce. So whatever we are born with, we have. And when you're trying to get pregnant, you're smoking and it decreases and actually lowers your egg count. So I like to try to tell all mothers you really shouldn't smoke while you're pregnant or even trying to conceive if you would like to increase your odds of becoming a mother. Some believe that it is related to genetics or environmental factors. Okay, I understand that. You have the secondhand smoke outside of here. You have genetics. But there's no statistics proving that smoking is genetic and that can cause birth defects and be brought down to the mother who doesn't smoke and be brought down to the baby. So just don't smoke while pregnant and you will find out how many babies' lives are being saved every second of a day throughout the years. Smoking has been around for decades, but over the years, people are becoming more aware of the side effects that smoking causes, not only to smokers, but to mothers who smoke during pregnancy. With a little bit of help and a little bit of a word being passed around, we can help mothers maintain a safe and healthy pregnancy for the unborn baby. A lot of people, when you go in through your hospital visits or if you're going in through your OBGYN, not a lot of mothers are aware of the smoking and the hazards that it causes the child. Most of the pamphlets that are being passed out are on breastfeeding or on the afterbirth and how you should take care of the baby afterwards. A doctor might ask if you smoke, and that's the end of the story. I think doctors need to be more informative when it comes to smoking, especially when you have mothers coming in and you can clearly smell the smoke on them. You know, you ask them how many cigarettes they smoke a day. You ask how many packs do they smoke during a week. I think that they need to be more informative and kind of help that mother to quit during their pregnancy to eliminate, because quitting smoking during pregnancy will not cause a miscarriage. It will only decrease any harmful defects for that unborn child and give that baby a healthy lifestyle when they are born. My final thought is, don't smoke while you're pregnant. Give your baby a chance of living a happy and healthy, safe life.